Abby. Good afternoon, everyone. Good afternoon, everyone. Welcome to the forum. All right, we're going to try this one more time. Good afternoon, everyone. Thank you. Welcome to the forum, a weekly program of the Columbus Metro Club, where we cultivate the conversations and connections that drive Columbus forward. The forum brings together visionary leaders, CEOs, members of Congress, college presidents, UN ambassadors, artists, and changemakers to examine issues that matter, exchange diverse perspectives, and forge connections that create a better Columbus. I'm Annie Marsico, Assistant Vice President for Local and Community Relations at the Ohio State University Wexner Medical Center, and I'm also proud to serve on CMC's Board of Trustees. For those of you joining us by live stream, we're coming to you from the Ellis in Columbus's historic Italian Village. Thank you so much to the presenting sponsors for CMC's long-running Optimal Health Series, Nationwide Children's Hospital, Ohio Health, and the Ohio State University Wexner Medical Center. Thank you to the sponsors of today's forum, Mount Carmel Health System, Cardinal Health, and Ian Alexander Photography. The presenting sponsor of our live stream is the Center for Human Kindness at the Columbus Foundation, and our live stream partner is the Columbus Dispatch. We're also grateful to the Ellis for hosting us. Every CMC forum takes a village. Let's thank everyone for supporting today's forum. The new Franklin County Health Map, the first since 2022, is expected to provide Central Ohio with a meaningful tool to better understand the critical health needs of our region. With today's amazing experts, we'll unpack the results of the new health map for a look at what's worked since the last study and the future work needed to keep Central Ohioans healthy. We are honored to welcome today's panel, Joe Mazzola, Franklin County Health Commissioner. Dr. Mysheika Roberts, Health Commissioner, Columbus Public Health. Dr. Andrew Thomas, Chief Clinical Officer for the Ohio State University Wexner Medical Center. Today, representing all 4 health systems on behalf of Central Ohio Hospital Council. And our host, returning to CMC once again, the one and only Tracy Townsend, medical correspondent and anchor with 10 TV this morning. Tracy, welcome back to CMC. The podium is all yours.
Good afternoon, friends. Oh, we're going to be casual. We got lots of questions. There's not a quiz, so good afternoon, friends. So I don't know about you as a medical correspondent. I feel like this is my Beyonce right here. This is exciting. We are going to dive right into this because we have lots of questions. Panelists, questions. Let's first start with the health map. What is it? High level, briefly, what can we learn from it? And I'm not going to call on anybody. You know, yes, I am. I'm going to call on you, Commissioner Mazzola. You take it.
Well, thank you. Thank you, Tracy. Good afternoon, everyone. Great to be with all of you, and it's great to be with 2 colleagues who I really think so highly of this afternoon, and to talk about what is a really important announcement for our community. So I'll speak briefly about Health Map 2025, and of course, I want to defer to my 2 colleagues here, but you know, this is an opportunity for us in Franklin County to really take a pulse of the health of our community. Health Map 2025 is really a snapshot, but it's also it gives us a good understanding of the health challenges and the health opportunities that we face here in Franklin County. And so we have gone through a process between Franklin County Public Health, Columbus Public Health, our 4 hospital systems, in collaboration with the Central Ohio Hospital Council and many steering committee members to really pull the data together, both quantitative and qualitative, and really put it in a format that will inform our public health planning for the next 3 years. So that's the elevator speech with respect to the Health Map 2025, but maybe Dr. Roberts and Dr. Thomas can elaborate.
Well, thank you, and good afternoon, everyone. I would agree with Commissioner Mazzola. That's all correct, and for us as health departments, as health leaders in our community, that's really what drives us, so what we're going to focus on. As you know, in this day and age, there's so many health issues that one could focus on, but this really helps unify us so that we're all moving in the same direction and focused on the priorities based on the health map. And hopefully with that unity, we can really make an impact in those areas.
I would just add to everything that Dr. Roberts, which is hard, because we know each other really well. We don't talk to each other so formally. Commissioner Mazzola and Dr. Roberts. The effort to do something like the health map grew out of a requirement from the Affordable Care Act back in 2010. Every hospital in the country, actually, that's involved with Medicare and Medicaid has to do a community health needs assessment every 3 years. Most communities where you go, they might have multiple hospitals. Each hospital would do their own. It would be focused on what that hospital needs. It wouldn't be focused always on the broader community need. We made a decision, the first one we did, this is our 5th total health map. All 4 hospitals came together, 4 health systems came together to do jointly the interviews in the community, the data gathering, so that all 4 of us weren't going in and asking the same exact people, some of whom are here next to me, for the same data and putting the same document together. But 2 times, not this one, but the one before, we now have added over 30 different community organizations to that table as the document's put together. So it's not just our 2 health departments, but multiple nonprofits in the community, other patient advocacy organizations. So it really, truly represents the community health map, not the Ohio State health map, the Ohio health map, Ohio health map, or the children's health map. This is a community effort, even beyond the 4 health systems that I'm here representing today. I know Andy mentioned that in the introduction. I just want to make that clear. I'm not here representing Ohio State. All 4 health systems are very much involved in owning this process in partnership with our colleagues.
I really love the sort of the subtitle of the health map. It's navigating our way to a healthier community together. And just to build on something that you said, I wanted to ask you to talk about who should care about this. I mean, we're talking about the Franklin County health map, but does it concern folks who live in the collar counties, Delaware, Fairfield, Licking? Because we talk about Central Ohio, Columbus, and Franklin County so interchangeably. If I don't live in Franklin County, how concerned should I be about this? How does it affect me and my family?
I can maybe start a little bit with that, and my colleagues can add in. You know, as a medical center, most people probably don't realize this, only 50% of our admissions come from Franklin County across all of our hospitals. Another 15% at Ohio State come from the 6 contiguous counties, but fully 35% of our admissions come from the rest of the state of Ohio. So when we put programs in place, we don't ask what your zip code is. If there's an innovative program around behavioral health or infant mortality, if we are caring for you, you get that level of care regardless of your zip code. So I think at a broader level as a community, obviously Columbus being the state capital also drives a lot of discussion for different programs the state could employ. These 2 work with their other county health department directors and city health department directors around the state. And I think if we've been able to put something together here, pilot it, show that it works, that oftentimes is transferable to other districts. And maybe you could add more to that.
Well, and I will just add that, you know, we are the hub of this metropolitan area here in Columbus and Franklin County. So a lot of what we see here does spill into other surrounding counties. You know, one example is housing. We know that's not just a problem for us in Columbus and Franklin County. It's a problem for our whole regional area that we need more affordable housing. So many things are not just isolated to where we call home.
And maybe just one more quick comment on that, if I could. So Franklin County Public Health, in partnership with our Central Ohio health departments, including Columbus Public Health and 14 others, we do a lot of planning in Central Ohio. A lot of it is centered on emergency preparedness. But when we think about emergency preparedness, we also think about transportation, and we think about housing. We think about the infrastructure of Central Ohio and some of the risks that are associated with that. So our health assessment is really, I think, a good sort of roadmap, not just for us, but we do want to try to align with our other county health departments in Central Ohio, because from a planning standpoint, we do need to continue to coordinate and collaborate.
All right, let's talk about some of the stops, so to speak, on this journey that we're taking, the prioritized health needs affecting Franklin County in this report. Social drivers of health with a focus on, we just heard Dr. Roberts talk about this, housing, mental health, adverse childhood experiences, maternal and infant health, violence, and injury-related deaths. So where do we start in terms of how healthy are we? If we go for our physical today in these areas, where are we? See a little medical thing. I'm trying to pretend I'm a doctor.
You know, and when we did the health assessment, we didn't grade it that way in terms of how healthy we are. We talked about how we could improve as a community and what areas we needed to focus on. You know, I think if you've been listening to anyone in public health and in healthcare in our community over the last 10 to 15 years, you've heard us talk about infant mortality, and you've heard us talk about infant mortality is the most sensitive indicator we have of how healthy our community is. Unfortunately, here in Franklin County, infant mortality is high, it remains high, but what's most concerning is the disparity between black and white babies. So black babies here in Franklin County are 2.5 to 3 times more likely to die before their their first birthday. And so that is what we've all been working towards. How can we improve that? And we have state-of-the-art hospital systems here, right? We have one of the best children's hospitals in the country, but yet our babies are still dying. It is not because of lack of health care. It is the infrastructure, those social drivers of health that we have to focus on. And so, you know, if you want to, Tracy, you could say that was ranked #1. So that is something that we feel that if we can make a difference there, we could impact a lot of different health issues.
Make a difference in terms of housing.
Housing, transportation, access to care, jobs, education.
And I think it's to your point about it's not just the hospitals. That's exactly why we've broadened out the health map to include those 30 organizations from around the county, because it's not something that we can do solely as healthcare organizations. It's really a community-wide effort. We certainly have a big part of that in terms of the care we provide, the services we provide, but it's not solely something that healthcare organizations can do alone.
Can you, anybody on the panel, unpack what it means to be struggling for housing and how that might affect your family's health?
Well, I think, you know, it's obviously a very, I think, a complicated question, but, you know, and thank you to all of you who work in this space, who work to address affordable and safe housing for our community. We know that there are a lot of challenges that the housing sector is presented with right now. And from an affordability standpoint, you can't, if you're spending more than 30% of your income on housing, we know that then presents all sorts of other financial stresses for you and your family. Dr. Roberts talked about the other social drivers. Access to healthy foods is the next one. Transportation. We hear all the time that too many of our families are one you know, sort of event away from really financial you know, stress. And so housing really is kind of at the center of all of that. And just to echo what Dr. Thomas said, you know, we have those partners at the table, and that was so important for us so that we could understand. I'm not a housing expert, but many in this room are. I'm not a child care expert, but many in this room are. I'm not an educator, but many in this room are. We have to be able to collaborate and understand what are the solutions to those issues and how does that then impact the health opportunities. You know, when we think about public health, we think about how do we create the best circumstances to create the best opportunity for optimal health for our residents. That's what we're trying to achieve. So when we think about housing, it's a really complicated topic, but there's a direct correlation between access to affordable housing that's sustainable as well.
Yeah, I think I would just put it this simply, like when your day is done with work today, I would imagine most people in this room, if not everyone in this room, knows where they're going to lay their head tonight. And you know that when you do get home, not only will you have a safe place to lay your head, but if you have to take evening medicines, you're going to have water there for you to swallow that medicine pill. If you have medicine that needs to be refrigerated, you're going to have a refrigerator that can hold that medicine. There are too many people in our community that don't have that luxury. And that causes undue stress, and that stress affects your body and thus affects your health.
Just to maybe bring it down to the tactic level, when we think about housing in relation to infant mortality, there's a program called the Medical Legal Partnership. So this came out of many of you are familiar with Celebrate One. It's the community-wide effort with the city around infant mortality. But as those issues that came out of the Greater Columbus Infant Mortality Task Force were kind of parceled out to different organizations, the 4 hospital systems in town created a group called OBO in conjunction with the health department. It's Ohio Better Birth Outcomes. And we get together quarterly as senior leadership on the OB side as well as the medical center side to say, what can we do to help? And actually, I should recognize Jeff Klingler. Jeff, where are you? Can you raise your hand? If you don't know Jeff Klingler, get to know him. Jeff is executive director of the Central Ohio Hospital Council. He leads a lot of these collaborative efforts on many issues, but medical legal partnership is one of Jeff's passions. So the 4 hospital systems came together to fund legal aid for pregnant women who are at risk of being evicted, at risk of having their power turned off, or whatever service they may need that they aren't going to have access to. And we provide free legal services for those patients so that, in a way, that's a very tactical thing, but it came out of this recognition of the broader issues in the community and where there were risk points that we could maybe help impact.
So it's a sort of a step in a good direction. Can we talk about what's happening with mental health in Franklin County so we can talk about the needs there and any progress being made?
Sure. I think we all know that during the pandemic, we started talking a lot about mental health, and people started being more open about the mental health challenges they were facing or their loved ones were facing. And it really ripped the Band-Aid. Just the isolation that many had during the pandemic really exposed the underlying mental health issues in our community. So we're fortunate that just last month, here in Franklin County, with the support of our 4 hospital systems, Franklin County, City of Columbus, and the ADAMH Board, we have opened the first mental health crisis care center in the state of Ohio. This will be a 24/7. Yeah, that deserves a round of applause. Yes. And I'm sorry that our director of ADAMH, Erica Clark-Jones, couldn't be here today, but she deserves a lot of kudos for that and organizing us all to make that happen. But this will be a 24-hour center that will be focused on helping individuals who are in crisis. And this is going to take a lot of burden off of our hospital ERs, who sometimes are struggling with individuals who just need mental health care. We know that suicides have gone up in certain populations in in certain subgroups of our population, and we know that behavioral health care is limited. There's not as much behavioral health care as we need, whether that be counselors, therapists, or people who can just prescribe medication. So the beauty of the crisis center is that there's really 3 components. So, right, one is an urgent care. So think of it as urgent care, but for mental health issues. The other is a 23-hour hold, if I'm not mistaken. And then there's a longer-term care center as well, all within one vicinity. And it's really, really going to help. Once it's fully operational, which I think we expect it to be fully operational early 2026, it's going to take a huge burden off of our hospitals, but most importantly, it's going to be an access point for all residents here in Franklin County to get the help they need.
Can I just have each one of you answer this question? Was there in this, I think it's 175 pages, was there a single factor or issue in this new health map that you think, or that maybe shocked you, is urgent?
I think we're all pretty close to this, so I'm not sure any one data point shocked me, but I think when I first saw the first draft and came back, I thought the most innovative thing in this version compared to other versions is the focus on adverse childhood experiences. I think when many of you know Luan Fan, who's our chair of psychiatry at Ohio State. He talks a lot about people in crisis and they're pulling them out of the river, but let's go upstream and find out why they fell in. It's actually a quote from Desmond Tutu. But when I think about adverse childhood experiences, especially as the way it's, I think, defined very well in the document, you can just, well, many of us have children, you can imagine something that happens to them at 5 or 6, that's generations of issues in the future. So I think that's probably the biggest innovation of this version of the health map that I found very powerful. I don't work at Children's Hospital. I know, Ray, you're here. Others from Children's are here. But I think that is another way that we can all partner together to make sure that those events happen less frequently. But when they do happen, there's a place for those folks to get care, and to prevent PTSD and other things in the future.
And would that kind of care be not just for the kids, but other people involved in whatever?
Oh, certainly, certainly.
I was going to say the same thing. You said it very well, Dr. Thomas. I'm so thankful that we have highlighted ACEs in this document as a priority. We've been talking about ACEs now for many, many years. We've had, at the health department, we've worked with many of you to host every other year summits on the topic of ACEs, and our next one's going to be next month, actually, July 21st, where about 400 of our colleagues are going to get into a room and talk about the impact that ACEs has on not just the individual, but on the family and on our community. And one of the things that we're really going to stress at that summit is how do we become an ACEs resilient community? What does it mean for us in Franklin County to say, how can we obviously prevent ACEs, but for those who have experienced a high ACE score, how can we put those protective resources around that individual and that family so that they can continue to thrive? And it really is, I think, going to be transformational. And really speaks to what is the root cause of some of the pressing health issues that we see in our community.
You know, as journalists, we cover sort of the after effect of an ACEs. Why hasn't this just sparked some, like, let's get this done, people, right now?
I would say that that's happening right now. I think that really is happening right now. I think that we finally...
Now tell me where, how is it happening?
I'm sorry?
Where? Give us an example of how it's happening now.
Well, I think that summit is going to be one example. When I talk to organizations around this community, you could hear it in their voice about that we have to do better with respect to preventing ACEs and then those protective factors. And so, but where I think we've really uncovered, and we're not unique in here in Franklin County, but I think that there's so much energy and commitment to the work. I think it is happening.
No, I would echo both of you in terms of ACEs being included, because when you look back on previous health maps, many of the things that we listed have been there before, but ACEs being called out really for the first time and getting that attention. And in public health, we're always looking at prevention, and so how can we get ahead of that and really, what can we do as a community to train and teach our parents about the impact what they're doing and what their children are experiencing and how that can impact behaviors later on in life.
As I mentioned, I'm here representing all 4 systems. Our colleagues at Children's have an amazing, Patty McClyman is here, have an amazing program related to school-based clinics. And we also have some local school systems that we work with and provide counselors for. I think there are parts of this where it's going on. For example, we've had for now well over a decade a Victims of Violent Crime program that's actually funded through the Ohio Attorney General's office. When Governor DeWine was Attorney General, we got our first grant, and we provide 12 free visits. Now, we do it for adults. Adults that have been a victim of a violent crime, with the goal through our STAR program of reducing the risk of PTSD. I think there are really evidence-based ways to respond, but what I think and those have been in place in some cases for many years. What this is going to be about prevention, and the type of discussion Joe's leading with community agencies, school systems at the table is going to be really important.
And Tracy, if I could just add something that we're doing at Columbus Public Health, and we started as a pilot, and we're hoping to expand it, is we started a program called Hope at Home, where we are providing mental health services to our pregnant and postpartum moms that we do home visiting with, and we realize that they need assistance in the behavioral health space. We can't do it alone. I think the ink probably isn't even dry yet on the partnership we're doing with Ohio Health to help bring in physicians to help us prescribe medication when these moms need prescriptions, but really making sure the mom is mentally healthy, so when she's raising that child, maybe we can try to avoid some of those ACEs from occurring in the first place.
All right, so we're talking about Franklin County. I remember when I was reading the report, I saw some maps with zip codes. Can we talk about zip codes or neighborhoods that may be being left behind in terms of their health status or their health needs?
Well, it looks like you're looking at me. So, unfortunately, not all neighborhoods in Franklin County have the same resources, and so as a result of that, we see change in health outcomes in those neighborhoods. So you've heard us talk about food deserts, grocery store deserts. There are healthcare deserts sometimes, although our hospitals are doing a great job of making sure there's a healthcare system almost on every corner now, but I won't go there. We're very fortunate to have
You
our
went there already.
we're very fortunate. But no, not every zip code is created equally, and you've probably heard us talk about redlining before, and so we have neighborhoods, particularly in the city of Columbus, and even some that fall into Franklin County that were previously redline neighborhoods. So these were neighborhoods that the federal government deemed as not acceptable and shouldn't get the best home loans. And so as a result of that, the infrastructure in those neighborhoods never came to be. People fled those neighborhoods when they had the opportunity. And so in those neighborhoods, we see the housing quality being poor. We see access to grocery stores, full service grocery stores being very limited to none. Sidewalks aren't great. We also see crime in those areas. You see individuals in those areas who are unemployed, and so their health outcomes are not the same. If you look at different neighborhoods in Columbus, there are areas that have a 10 to 15 year higher life expectancy than others. And that's just unacceptable, but it's all about place. Place matters. And so where you live matters, where you go to school matters, all of that matters. And so we have to, again, thinking about those social drivers, we have to do better so that everyone in our community has the opportunity to thrive and live a full life.
And I just quickly want to just add, this would be a good opportunity to just say kudos to the teams who put this document together and really dug into the data so that we could understand the disparities in our community, whether it's by zip code or otherwise, and really want to continue to emphasize the fact that we are taking an equity approach to the work at Franklin County Public Health, and I know we're going to continue to look for how do we close those gaps. It's unacceptable. It's truly unacceptable that someone in one part of Franklin County, that their life expectancy is likely to be 15 years higher than somebody else's. That's not something that we can accept. And so we're really, really focused on that, and this document gives us that information.
So, Dr. Thomas, I wanted to kind of come to you now to talk about, when we talk about these health disparities, and since you're representing all of the hospital systems today, can you talk about how the hospital systems, the institutions, are prepared to deal with this? I mean, these are systemic issues versus, symptoms. So how has that changed how hospitals do business, so to speak?
It's a great question. I think I'll answer it a few different ways. Jim O'Brien is here from Ohio Health, runs their population health work. But there are examples of folks focused on this in all the systems. They all, to some degree, coordinate and collaborate together. But that list of zip codes that you were talking about in your last question help us to define where to put resources. So, for example, at Ohio State, we have actually a federally qualified health center within the university. It's actually run jointly with the College of Nursing and the Medical Center. It's located in the Near East Side. It just announced it's going to open a second location out in an old Eastland Mall site next to a Mid-Ohio food bank site that will be open there. So as we go and think about where we pick for next sites, that zip code list is really helpful to us, and I think all of the systems use that to focus where we put different services. Similarly, many of you may be familiar with our Healthy Community Center. This is it opened in May a year ago on the Near East Side, about 2 blocks from East Hospital. It's actually the original Martin Luther King Library for the country. We traded some land with the library system, and they built a new library just south of East Hospital, and we took over the old library and rebuilt it with the community at the table to not deliver true healthcare services there, but we do screening there. We have a test kitchen. We teach people how to cook healthy meals. We have exercise. All of it is free to members of the community. Any organization in the community can use the space as long as they don't charge, we don't charge. So that's just an N of one right now, but we're envisioning other kind of place-based approaches around the city. We're partnering with Children's on a very innovative clinic with pediatric and adult providers in the Linden area. So I think all of us as systems think about that map as we are trying to figure out what services should go where around the city.
And I would just say all of the systems have mobile units, and so they use that same data to determine where they're going to go with their mobile units, particularly in areas where there is not a brick and mortar healthcare center.
Okay, let's put a little current news stuff here. This is the only question. This is a tough one. Put your thinking caps on. Preventive care, moms, dads, guardians. This summer, we're trying to get our kids in to go see the pediatrician so they can get their vaccination. And the 2025 health map indicates just over 86% of Franklin County kindergartners received all of their required vaccines. We just finished wrapping up the measles. Measles is back, y'all. Sorry. And then pertussis is another issue that's out there. How might the new direction of the U.S. Department of Health and Human Services, specifically at the CDC, and the changes regarding vaccines, how will you talk to patients, people who...
It's called...
I mean, how will you talk to families about this? We're going to be doing a lot of back-to-school reporting. I mean, people who watch Channel 10 know I'm always talking about vaccines. What do you tell people now?
No.
She said, how do you talk to patients? So I guess I will just say we always need to follow the science. So vaccines have been around for decades, and they are safe and they are effective. And that's why so many of you might not have ever been aware of someone who had polio or who had mumps, because the vaccines have been working, and we don't see those diseases when we get our population vaccinated. Now, you gave the quote of 86%, but if you go into certain zip codes, certain neighborhoods, that number will be even lower in terms of vaccine coverage. And those are the populations that I really worry about, because that's when we're likely to see the resurgence of some of these vaccine-preventable infections. So again, I ask, when someone comes to me in doubt and questioning a vaccine, particularly one that's been around and effective, I ask, were you vaccinated? And most times, if it's an adult over the age of 30, they say yes. And then I said, okay, so then tell me why you are reluctant to vaccinate your loved one who is an innocent child who really is not making this decision for themselves. And we need everyone to follow the science and listen to experts like those of us on this panel.
Ditto? I don't know. No, I think Dr. Roberts is on the mark. I think, and I found this during the COVID pandemic. I would actually not uncommonly get calls from colleagues that knew I was a little closer to it than they were, and they had a cousin somewhere who didn't want to get vaccinated, and can you spend 10 minutes with them on the phone? And I would typically, to your point about asking them why they're concerned, they would say, well, I've read online or on the news that it's a risk of 1 in 50,000 to get myocarditis from the mRNA vaccine. I'd say, okay. And they're, I'm really worried about that. Okay. Do you realize if you get COVID, it's more like 1 in 50 chance that you're going to get myocarditis? Oh, I had not heard that. So they had a piece of information taken out of context that sounds really risky, but they didn't realize what the other alternative is. Because these diseases are not common in our community and they don't know someone who's had mumps, know someone who's had polio, they actually, even if it's a risk that's a small risk, they don't understand the impact these diseases can have on a child, on their loved one. And I think similarly, there's a word out about certain vaccines not being tested, which is just patently untrue. So to your point, follow the science, and I think we will hopefully get to a better place as we have broader conversations, but asking them why are they concerned is a big part of how I've gotten through that with my own patients.
Okay, I'm going to ask you guys a nice question. Thank you for answering that. If you had the power to redirect healthcare funding right now, today, what overlooked area would you invest in first and why?
I would, well, I think unfortunately, there's a lot of funding challenges when we think about the public health priorities for not just Franklin County, but for the state of Ohio in particular. We're seeing funding cuts in the area of tobacco prevention and cessation, for example. We're seeing funding cuts in the area of lead. We're seeing funding cuts in terms of access to healthy foods. So that's kind of a tough question, Tracy, but because unfortunately there's a very long list of public health priorities that just has historically been underfunded. Prevention in general, we just haven't prioritized and incentivized as much as we could to prevent a lot of this. I think that's our timer.
It is.
But I think that's ultimately, hopefully we can continue to invest in prevention. Prevention, we know what works, and we know it saves, obviously, not just money, but it saves lives.
I'm going to avoid the risk of picking out one specialty because I'll get mean emails when I get back to work. But I think I would take a little different tact. Personally, for me, I think if I were to take some additional funding, it would be the infrastructure in our rural and Appalachian parts of the state. When you look at the health metrics of the state of Ohio, we rank 9th from the bottom in terms of statewide public health metrics. If we do not improve healthcare outcomes and access in rural and Appalachian parts of the state, Ohio's metrics, we can put all the money we want into Franklin County and Central Ohio. So I think finding ways to work with the state legislature, work with the federal government on the rural and Appalachian parts of our state, making sure that whether it's through digital services, in-person, whatever it is, that we can increase access, bring innovative clinical programs to those communities, and frankly, bring workforce to their communities. All of us as systems in Columbus are growing, we're hiring, but we need high school students an hour and a half away to know they can be a medical assistant even if they don't have anyone in their family in healthcare. It's not going to nursing school or medical school. Start small. You can start this point in your career, eventually go back and do something, if they want, that's a licensed profession. But I think that the rural and Appalachian parts of our state is probably where I see the biggest need for focus and infusion of resources.
And selfishly, I would just say more funding in public health. So if you think of healthcare, and for every dollar we spend in healthcare, only a cent, a penny, goes to public health, which is where prevention is, right? And so it would be great if public health could get more resources that was unrestricted, and that we as the community could decide where it's best to put those resources, like what our Health Map 2025 tells us, because what works for us in Columbus might not work for Cleveland. But I don't need someone to tell me what's going to work, because they don't know our community. I know our community. We know our community, and we can put those resources where they're best used. Just like Dr. Thomas said, in Appalachia, what they need is different than what we need in the urban areas.
Thank you for that. It is the CMC longstanding tradition to take audience questions, and we're going to move to questions from our live stream and from you here in person in just a few minutes. If you have a question, we'd ask you to make your way over to the microphone. Doug is waving his hand. That's where the microphone is. If you're joining us on YouTube, type your questions into the chat. Before we get to audience questions, Tracy gets to ask one more question. And this is it. 5 years from now, are we still going to be talking about these same issues?
Dr. Roberts just said, let's hope not. I agree. I really hope, I have we have in our community health improvement plan right now, we have a little heart that says hope on it. And hope is not a strategy, I get it. But this community gives me a lot of hope. This room gives me a lot of hope. And I don't think it has to be that way. I don't think we have to come back 3 years from now or 6 years from now and say we're still dealing with some of these public health challenges. I think we've seen decreases in a lot of different indicators, and I'll invite you to look at that. Heart disease, overdoses are declining. We've seen successes, but we have more work to do, and I think with everyone in this room and in our community, I think we can continue to make those changes.
Okay.
Yeah, and I have that same hope, but I do know that we've been talking about infant mortality for some years, and it's been on the list for over a decade, if not longer. But since we've been doing Health Map 2020 Health Map, it's been there. So I hope we can make progress and continue to make progress on the issues that we're seeing progress on, and really drive down those infant mortality numbers. Would be great to see in 5 years. But if we don't invest in healthcare, if we don't have Medicare, if we don't have Medicaid, if we don't have the resources, we're not going to be able to see that progress.
I firmly believe that we will be in a better position than we are now. But as we think about adding 1 million people to this community over the next decade, and I think about them all being, and all of us being human beings that are fallible, will make mistakes, will get themselves in difficult spots. There are always people that are going to need help and assistance from a public health perspective, a mental health perspective, whatever it is. My hope is, 1, the metrics will be better, but 2, we'll have even more tools in our tool belt. We talked about the Franklin County Crisis Center. 5 years ago, that was like a vision, not a hallucination, but a vision, right? It was really, we knew we went, but it wasn't done. When we all sat there last month and watched that opening, it was like a tangible moment. I think the 988 system that the state has invested in for suicide prevention, and the emergency resources the state is, those are tactics and tools that help us be better as a community. I think 5 years from now, we'll have even more of those. We may not even know what they are today. That's my hope and desire. But I think we'll always need to have these discussions because we're all human beings.
Thank you so much. All right, I think we have some folks. Oh, we have a line. Yes.
Tracy, thank you very much. Thank you so much to today's panelists. If you do have a question for today's panelists, please join us here at the microphone. If you're watching online, type your question in the chat. We'll try to get to as many of those questions as we can. Great questions at CMC always have 2 things in common. They can be asked in just a sentence or 2. And what punctuation mark does a question end with? It ends with a question mark. That's right. It's always good to remind ourselves of that. Here's one to launch us off with. Dr. Roberts, this builds on a comment that you made. If Ohio's Medicaid expansion is rolled back, what impact would you see potentially in future Franklin County health maps?
Well, I mean, that's a great question. And what we're going to see is fewer people in our community will have health insurance. And so they will be relying on our federally qualified health centers. They will be relying on free clinics. And they will probably go without certain tests or screening tests done. They might even go without medication that they need. So we could actually see some of that life expectancy data that I shared earlier get worse. We could see our infant mortality rates get worse. We could see our overdoses get worse. So it could make a significant impact on Health Map 2028. And it's something that we're all bracing ourselves and hoping that doesn't come to fruition. I am most concerned about what that means for our hospitals. And I don't want to speak to that on behalf of them, but that's where I'm really concerned, not to mention the individuals' health that are going to lose that coverage.
Yeah, I think in that setting, Doug, our emergency departments oftentimes become the care of last resort. I think we all know what that looked like before the Affordable Care Act and Medicaid expansion. I don't think any of us want to see us get back to that point. The other point I would make about the Medicaid expansion population is, compared to the rest of Medicaid patients, Medicaid expansion patients have a higher percentage of patients with mental illness. I think when Governor Kasich made the case for Medicaid expansion back well over a decade ago, that was one of the key points, is if we want people to be able to finish school, hold a job, have a family, contribute to their community, these are people that needed care and needed not just the preventive care that Dr. Roberts is talking about, but in many cases mental health care. And for them to lose that is like tying one arm and one leg behind their back.
Thank you for this great panel. My name is Eric Davies of Transformative Consulting, working a lot with the community health centers, FQHCs. And when I look at the state budget being hammered out down here at the State House right now, it seems to not support the picture we're talking about today and may even erode it further. Medicaid also is a major concern of mine, as the previous question Doug just shared. So if 500,000 to 1 million people in Ohio get thrown off Medicaid, and we continue to erode this picture with our funding in Ohio, not to mention the federal budget. Are there new models we need to be thinking about as a community in terms of bringing health centers, hospital systems, employers together? I don't think employers win with the budget cuts that cut Medicaid and other services. I think it just erodes the employment population. So are there new ways we need to be thinking if this model with the current funding happens and plays out the way it looks like it could? Thank you.
I could maybe start with that one. I don't know what those models would be, but I think it's a great question. To be honest, I think a tool like the health map that we're talking about today gives us a roadmap to potentially have those discussions. I'm slightly optimistic that Medicaid, the worst case scenario for Medicaid may not come to fruition to some degree, mainly because there are a lot of for lack of a better word, red states that have Medicaid expansion as well. And I do think that as this has been discussed, it's kind of made for some interesting political affiliations in Washington that I'm not sure I would have put together prior to this in terms of people recognizing what these changes will do in their states or in their communities. So I'm hopeful that we won't see the worst case scenario. But if it does occur, I'm completely convinced the people that came around the table to build this health map will come around the table again and do what we can do to try and help the FQHCs and others to think innovatively about this.
I would say that we absolutely will have to do that. I think that this is a policy decision that certainly could be almost catastrophic, I think, for many of our residents. And so I think it will be incumbent upon us to really convene a conversation to say, what is it that we can do here in Franklin County to respond to the changes. And I just want to say, our Medicaid managed care organizations who serve Franklin County are tremendous partners of ours. They show up at every event. They are genuinely engaged in the community, and we're really grateful for that.
And I would just give you some reassurance that in this community, the healthcare partners, whether it be public health, the FQHCs, or hospitals, we know how to do that. We do it all the time, but we specifically did it at the beginning of the pandemic and throughout the pandemic to respond and make sure that everyone in our community got what they needed. So we know how to do this and can do it.
Thank you. Just a quick follow-up question. FQHC, could you define that for us?
FQHC, Federally Qualified Health Center. These are a health center that has that designation, meaning they get some financial assistance from the federal government and get to charge a little differently.
Thank you, Dr. Roberts. Thank you. Watching online, Laura Fay asks, can someone talk about the issue of asthma? Is this problem getting worse or getting better according to the health map?
Well, asthma can often be exacerbated by environmental pollutants, and they could be coming from your own home. So it can come from, obviously, smoke inhalation in the home, but also it can come from rodents and their excretion and their products, and that can cause fumes, and that can exacerbate asthma. And I think that, I am not a practicing physician, so I can't speak to what people are seeing in the ERs or in their outpatient settings, but I think we have been better at, well, I shouldn't say better at, we are probably diagnosing more individuals with asthma than we did before, and our threshold might be a little lower. I don't know, Dr. Thomas, if you can elaborate.
So I've not looked at that piece of data, Doug, from the study in a while. But what I would say is there are known treatments and therapies for asthma that work that are now generic, that are relatively inexpensive. There are some cases that are really bad asthma that need other things. I think it really comes down to access. If an individual has access to really a primary care provider, you don't particularly have to see a pulmonologist with asthma. There are inexpensive ways that we can try and help keep someone safe, but once again, if folks don't have access, it would be 100% worse for them, even though it may not be worse for the community.
Good afternoon, everyone. My name is Ray Bignall. I'm a pediatric nephrologist at Nationwide Children's. I'm a faculty member in the Ohio State University College of Medicine and the Chief Health Equity Officer at Nationwide Children's as well. We've talked a lot about Medicaid. This is a five-alarm fire for most of the people in this room. We recognize that the populations here in our state, the people that we all came here on behalf of, many of them rely on Medicaid for their health care, and it's what's going to help keep our community safe today. I'm worried about what's going to keep our community safe tomorrow. I'm a part of an academic health center, and that means that we do research to understand what causes diseases today, and as you so eloquently put, quoting Desmond Tutu, figuring out what it is that's throwing babies into the river and preventing them from getting there in the first place. So the question I have for you, every single one of those metrics that we talked about are metrics that we study at Nationwide Children's and at the Ohio State and many other places as well, and yet they are also the very same metrics that are on the chopping block, both here at the state level and also at the federal level. We probably can imagine some of the motivations behind that. The question I have for you is, what are the tactics that the people in this room can use to ensure that our ability to study disease and study these social drivers of adverse health is strengthened and not weakened? What is it that we are not doing that we could be doing better in order for our patients, their families, to be healthier tomorrow than they are today? Thank you.
Thank you for that question, Ray. I would take a second, probably better answer this question. Dr. Carol Bradford, who's here today, she's Dean of the Ohio State University College of Medicine, but I'll channel my inner Carol and do my best to answer that. So a couple of things. One, I would say the way we do science, thinking about what is basic science versus translational science, where you're taking things from the bench to the bedside, and then implementing health services research, so how we deliver services. We probably need to find a way to do some of that differently. So team science, so that it's multiple partners in an interdisciplinary team, not just surgeons and medical people working together on a research trial, but physicians, nurses, social workers, all on the same research trial. So we're doing that science more efficiently and effectively. I do think that it calls out for land-grant universities that have a different purpose. Not that our private medical schools and private universities across the country aren't amazing and do great work, but the way we look at research in terms of the benefit to the state of Ohio, if anything, hopefully more will accrue to us as we look at those models, and how do we partner with communities on studying their things as opposed to being in an ivory tower and just looking out and trying to figure out what's going on. So I think the way we do it will have to be a little bit differently. I think we'll also have to look for other sources, whether it's foundations. The Gates Foundation has made a huge effort, and I think would continue to do that if these funding cuts went through. I think corporations, and we've sometimes, from a journal perspective, they look at corporate-funded research as maybe a little bit conflicted. I think we need to find a way to work with corporations to have them invest in that research that isn't just about their drug, but it's way upstream to work on those diseases. So that's a short answer to a really, really complex question that we spend a lot of time thinking about at Ohio State.
Thank you. We have about 3 minutes left for a final question.
My name is Arlene Sheik. I most recently retired from work in southeast rural Appalachian, Ohio. I am a volunteer with Healthcare for All Ohioans, where a physician member says, healthcare does not belong in the marketplace. If there's a sale on heart surgeries, are you going to have two? We are the only industrialized country that does not have some form of universal health care, and I wonder if you think that this is a worthy goal for Ohio, and I thank you for all that you're doing.
Me again. Well, I will tell you, I'm a primary care physician by training. As I mentioned, I still see patients every week. I certainly resonate with your comments around the importance of having a primary care provider, whether it's a physician or nurse practitioner or physician assistant. I do think it's important to set that baseline in terms of basic screening, basic access. At the same time, I also wouldn't trade if I need a high-end cancer treatment because I have that cancer, we want to make sure we have it. So it's a both and, it's not an either or. To be honest, the question earlier about Medicaid expansion gets to the point where our percent of patients that are uninsured has gone down substantially since we had Medicaid expansion, not to the point where it's truly universal coverage, but it's getting close. The one segment that is still not eligible for Medicaid or undocumented folks who live in our communities, but I agree with you that having that standard baseline of everyone having a primary care provider would be a huge step forward, in addition to the great science and great technological resources that we put towards people's subspecialty care.
And I guess I would just echo, and I agree with what Dr. Thomas is saying, and there are people who are insured who don't have a primary care provider. So it's not just about the universal coverage for everyone, but it's about everyone who has the access taking advantage of it as well.
Everyone, I hope you found today's conversation informative. I know so many community members dedicated their time to create Franklin County Health Map 2025, which will be our guiding document for Central Ohioans' health for the next 3 years. Thank you so much to the presenting sponsors of CMC's long-running Optimal Health Series, Nationwide Children's Hospital, Ohio Health, and the Ohio State University Wexner Medical Center. Thank you to the sponsors of today's forum, Mount Carmel Health System, Cardinal Health, and Ian Alexander Photography. The presenting sponsor of our live stream was the Center for Human Kindness at the Columbus Foundation, and our live stream partner was the Columbus Dispatch. Thank you to the Ellis for hosting us, and our very special appreciation for today's speakers, Joe Mazzola, Mysheika Roberts, Andy Thomas, and our host, Tracy Townsend. Next week's forum, our annual State of Nonprofits, is sold out, but please make plans to join us online if you're not already registered. And don't forget that next week's forum will take place at the beautiful National Veterans Memorial and Museum on Broad Street. Thank you, everyone. We could not do this without you. Have a great afternoon.